Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Hey everyone, welcome back to another episode of HealthiHer. This is Dr. Amy Brenner, board certified in obstetrics and gynecology, as well as functional and anti-aging medicine. And today we have Jack Reed. He is the director of client operations at a company called INMODE, where he's been for about 5 years. And he possesses almost a decade of experience in business development and marketing experience in the aesthetics industry. Jack is here today to talk with us and help us better understand the landscape surrounding women's wellness procedures, specifically INMODE's device called Votiva. So thanks for joining us, Jack.
Hey, happy to be here. Thanks for having me, Dr. Brenner.
Yeah, so let's just unpack your introduction. Who is INMODE? What is this company you work for?
Yeah, so InMode's been around for almost a decade now, and we're probably the fastest growing global provider in the med tech space. And so what we do is manufacture and help support customers who purchase our devices. Obviously, you have the Votiva, the women's health device. And so there's a lot of different sectors and verticals in which we work in, but OBGYN, plastic surgery, dermatology, med spa, these are some of the main physician segments that we work with. But we do manufacture all of our equipment. And then obviously my team and myself are in charge of helping support all of our physicians and making sure that you're getting the word out to your patients, specifically for devices like Votiva. So they hear that, everything that you have in your office, all the different treatment options, and they know who to go to for that.
So today we're going to talk about Votiva, but what are some of the other devices, or I like to call them fun toys that make people look and feel better? But what are some of the other medical devices that INMODE has?
Yeah, so we have a lot of fun toys, as you said. I would say probably the most well-known at this point is the Morpheus 8. So this is a radio frequency microneedling device. It's been in the news a lot over the past couple of years. Organic growth is great, and that's pretty much how Morpheus has grown within our company and really throughout the country. But helps with skin tightening, helps with acne scars, surgical scars, stretch marks, cellulite reduction, all that great stuff. But yeah, it helps people maintain that youthful feeling, helps really contract the skin, get rid of any textural concerns, and just improve overall self-confidence and self-esteem.
Yeah, that's one of my favorites. I'd love to have you back to talk in depth about Morpheus. All right, so let's get back to Votiva. If you could explain to everybody Votiva, this is one of my favorite devices for women's intimate wellness.
Yeah, Votiva is awesome, and we've had this device in our portfolio for a little over 5 years now, and it's a bipolar radio frequency device. So the heat and energy is very much controlled and directionalized, which means it's safe. It's an in-office procedure. There's no pain, no downtime whatsoever. But really, this device helps women who have a variety of different symptoms, whether it be vaginal dryness, atrophy, painful intercourse, dyspareunia, all sorts of different things that really occur in almost every female. But then there's also some concerns after natural childbirth as well that this can help address too. But again, it's just a comfortable device that can be done in office. That's really quick and painless to the patient, which is a big benefit to them.
So explain what is it? Because it's not a laser, and but what's the mechanism behind how Votiva is working?
Yeah, so there's a lot of different devices out there. And you're right, it's not a laser. And there are devices out there that are lasers and they do work. I'm not going to say they don't, they work, but sometimes they are kind of that one trick pony. Maybe they're just addressing one concern. But with RF and bipolar RF, more or less, we can help address a variety of different concerns. And so not only are we helping to, fix and improve maybe atrophy and dryness, but we're also stimulating the muscle in the vaginal canal and kind of thickening the muscle. And I think most of your patients and you yourself, obviously, you guys are very familiar with Kegel exercises and sending folks off to physical therapy. This is a great alternative to that, as we're able to kind of do a number of different things with one modality. But because it's radio frequency, it's really just heat. And so we're just kind of bulk heating the vaginal canal. And again, stimulating collagen, kind of stimulating that muscle tissue, getting it to thicken. So we're really doing a lot with that tissue in the vagina and almost like reversing the aging process. And, it's not a one and done treatment. You're probably going to have to get a few treatments, if not maybe one more. And then it takes you up to about a year or so when patients, need to come back in and have another evaluation with you.
Yeah. So in our practice, we recommend 3 sessions, anywhere from 3 to 4 weeks apart. And then after that, to do maintenance treatments anywhere from 6 to 12 months. Although a lot of patients really, they just love this and will come in actually more frequently to have this done. One of the things you didn't mention, we use it for all those things. Tightening up the muscles, a non-surgical way for vaginal tightening, vaginal dryness. We also use it to enhance orgasms because it improves blood flow to the vagina. But then we also, probably our most popular reason for using Votiva is a non-surgical treatment for urinary incontinence.
Yeah, and I think you kind of hit the nail on the head with that. And that's where the RF technology really comes into play because again, whenever you heat the skin and you heat the muscle tissue, it does expand. Heat will make it expand. And that's what's happening in the vaginal canal too. So it's directionalized, it's safe, but you're bulk heating the tissue in the vaginal canal, which does make it expand. And so when talking about those symptoms, whether it be, women that like to go to the gym and do group fitness and, they're doing box jumps or they're doing jumping jacks and they're leaking, these are just, common everyday things that females do and they want to enjoy. But, doing Kegel exercises and physical therapy and the pills and the creams, they really just don't cut it and it's very cumbersome to them. So a device like this is perfect for them, but always good. And you say they come in sometimes even more frequently. And I think it's always good to have them in, more frequently than, hey, come in at the year mark. Let's see where you stand. Are you having any regression? The more they can do this and the more they can keep up with it, the slower the regression will happen and the less treatments they'll probably have to do when they do come in, if they decided to do that at about a year mark.
I also like to use it post-vaginoplasty, which is a cosmetic surgery I do to surgically tighten the vagina if somebody just has significant laxity where I don't think Votiva is going to be enough. But I like to use Votiva post-vaginoplasty, like 6 to 12 months later, to maintain those results after a vaginoplasty.
Yeah, I think that's a great application. And the great thing about you and what you do in your practice is you see, the principle of what Votiva is used for. You probably didn't do that right away. You got the hang of the device and you've been using it for a number of years now, but you got a hang of how it works, the energy levels, and then your brain started working in a way where you were like, where else can I use this where it will benefit my patients? And so it might not be something that we directly, tell our offices, hey, this is a great application for you to use this on patients, but you yourself obviously you've dealt with women in a variety of symptoms that they have, and you're able to use this in that way. And we love to hear that as well.
Yeah. I actually forgot to mention, I also use it on the external vulva or the labia majora to tighten that skin, because anybody in the aesthetic space knows that any kind of heat on the, or not any kind of heat, but heat on the skin in general is going to stimulate collagen and elastin and just cause some skin tightening. And so using it on the external vulva for some skin tightening of the labia majora is also, again, a non-surgical alternative, rather than a labiaplasty majora to tighten the labia majora.
Yeah, and I think with that too, I your patients and even you yourself, when you look at, before they come in and get the treatment done till, after they get their 3 treatments and you're able to see the results, even the skin color changes, right? Like you're seeing a healthier vagina, you're seeing, because you are improving blood circulation and blood flow with that. So even whether it be internal or external, you're actually able to see it. You're seeing the tightening, but you're also seeing the coloring changes, which obviously means that the device is doing a great job, the treatment's helping, and the therapy is truly doing great work for that patient.
Let's talk and explain to everybody listening of what a treatment is actually like. And I don't know if you want to talk about that, or I can talk from my experience. Before we got online, I told you that I am the worst patient. I have like zero pain tolerance, but Votiva is actually something, if I'll joke and say, if it wasn't in a doctor setting, and this was actually something you use in the bedroom, this is actually a really pleasurable, it could be a pleasurable treatment if it wasn't in a healthcare setting, but more in the bedroom setting. But but we want to explain like exactly what happens with a Votiva treatment.
Yeah, and again, I think we both know you're probably better at explaining this, and whether it be from personal use of the device and all of that, but from InMode's perspective and from just knowing this device as well as I have and speaking with all of our clinicians about it, the patient satisfaction rate is through the roof. Not many things can be 100%, but I'm pretty sure Votiva and this therapy is right about 100%. It's going to work almost every time. Patients are going to see almost instant relief. However, like you said, we want to have them come in at least 3 times. Typically, on average, it's 3 times for those treatments. But when they do come in, you're going to set them up. You're going to do your evaluation either before they come in or during. And it's a simple procedure. It probably takes, around 30-40 minutes to administer from start to finish. But you're inserting a probe into the vaginal canal. If the area is tighter, if it's drier, that's not a problem. This probe is small enough and ergonomic enough where it fits in almost every vagina, whether it be tight, whether it be dry. We're going to make sure with ultrasound gel that it goes in comfortably. And then when you start the procedure, it's just a matter of turning the handpiece clockwise and making sure that you're getting the energy around the entire vaginal canal area. And because the energy really shoots out of one specific area, it's not like 360 degrees. So you have to turn the handpiece itself 360 degrees, and then you're pulling out and then continuing the process. So it's relatively simple, but again, it's not like patients have any downtime whatsoever.
Mm-hmm.
There's no discomfort, no pain. It's just bulk heating
Yeah.
in the vaginal canal. So very safe and very comfortable.
And what's nice about the wand for this is it's a lot smaller than the wand for our CO2 laser. And so, I don't know, what would I relate it to? Maybe like the thickness of a magic marker or the bottom part of a butter knife. Like that's kind of how big it is. So maybe like the size of your thumb. So, or the width of it. So it's just not very big. So you're right. It's going to fit in even somebody that has severe atrophy or if people don't know what that means, sometimes I'll say shriveled up because people understand that word. It's not my first choice of words, but when people don't understand the word atrophy is it's gonna you're gonna be able to do that versus sometimes I can't do a CO2 laser if women have severe atrophy because the probe's too big.
Yeah, I've actually heard that, and if for whatever reason somebody is trying to use a CO2 probe and they also have Votiva in the office, sometimes they start with Votiva and then just to loosen up the area, lubricate it more, and then go ahead and use the laser. I don't know too many circumstances where people do that, but I have heard that, a couple of times before.
Yeah. And then also when we're using it to tighten the vulva, we're just kind of rubbing it on the skin and like it literally feels like a hot stone massage in that area. So it's not painful at
Yeah.
all. You can't really feel the heat in the vagina though. So
Yeah, and that's status quo for this technology. I know before we talked about Morpheus 8 and we're going to do another episode on that where we can dive way further into it. But yeah, this technology, whether it be in the vagina, the face, or the neck, that's what it's doing. It's just heating the skin. You're getting contraction. You're stimulating the muscles within the vaginal canal to make them thicker, and really just kind of reversing that aging process within the vaginal canal. And so you hope if a patient comes in and they're, in their mid 40s or 50s, you can get them maybe reduced to, in their mid 30s or in their low 40s. And that's your hope. That's your goal, is to just improve their overall well-being. Like we talked about, the gym goers, the people that do the group fitness classes, box jumps and jumping jacks, that sort of thing. It's just not right for women to go there and have to think that they need to wear a pad
yeah.
or diapers or creams and pills. Like, these are the therapies that work really well, not cumbersome at all, very quick and easy. And so hopefully, the word will get out there more, because I really feel like it's just not mentioned as much as some other treatments, whether it be for men or in aesthetics. This is something that hopefully will become less taboo, more talked about in the years to come and in the near future.
Right. Because women know about Kegels, but quite honestly, who really does that on a regular basis? And when I'm seeing a patient and talking about, the problems that Votiva can fix, such as, again, our most popular thing to use it for is urinary incontinence. And certainly physical therapy is in my discussion of options, but people don't want to do that. Like I would say in 20 years of being a gynecologist, I don't think I've ever had somebody say for incontinence, okay, I'll choose that option. Like it's a nice option because it's just like this. It really doesn't have any risks or downtime, but people don't want to do that.
Yeah, I think patient compliance is a big deal with any sort of physical therapy. And then when talking about Kegel exercises for physical therapy, that's definitely, patient compliance is 100%, that's what it is. And at the end of the day, they could be as compliant as possible, do all the Kegels, all the reps. But at the end, are they really seeing the results that they want? Are they really seeing that improvement? And I would say most often they're not. And, that's tough for someone to devote that much time and energy into something and still not be able to see the fruits of the labor.
Mm-hmm. I'm sure our consent form, because this is a medical procedure, has some discussion about potential risks. I personally haven't seen it. I think you'd have to be doing it and like not be paying attention whatsoever. But just for completeness of our discussion, what are some potential side effects or risks that maybe the company talks about?
Yeah, I mean, with side effects or adverse events, anything like that that have been reported with Votiva, I've heard nothing. So, like you said, you'd almost have to fall asleep at the wheel. The energy
Yes.
would have to be on one specific area for quite some time for, something bad to happen or, an adverse event, burn, something like that. But the energy is not high enough where you can hurt somebody when you're actually paying attention to it. And so with that, it's a remarkable thing that we haven't heard of anything with Votiva over the past 4 or 5 years. And so I safety, efficacy, those are our biggest things and our biggest concerns when making a device and putting it in providers' hands like yours. We want to make sure that you're delivering a therapy that works, first off, but we also want it to be safe. And so those two things are very important to us. And I know it's very important to you too. So in terms of risks, complications, again, there really isn't anything to worry about or for patients to worry about, if it's in the right hands of the person. And as long as they just stay awake during the treatment and
Yeah.
you're doing what you need to do, everything's going to be just fine.
Certainly, I'll talk to somebody if they have severe atrophy. You could have some spotting or some bleeding after the procedure, just like you would if you had a pap smear or pelvic exam. So just because the tissue is so thin. So that's usually the only real warning I give. As a company, do you tell people about any downtime?
So typically we tell patients to just abstain from sexual intercourse for, 48, 72 hours. That's usually not a big deal. Patients are really excited to find a solution that will actually work and will get them, back having sex with their partner or back in the gym. So those type of things, that's really it. But again, like, there's no downtime for this.
Right.
So the only
Yeah.
thing, I guess you can call it sexual downtime, right? Like
Right.
abstain from sexual intercourse for a few days. That's it. We just want that area to naturally heal on its own. And that's the reason for that.
And then one last question. Is there any patients out there, any medical conditions where somebody's not a candidate for Votiva?
So I would say the best candidates for Votiva are, of course, premenopausal, postmenopausal women that are suffering from itching, burning, painful intercourse. Obviously, we talked about incontinence. Those are great patients to do Votiva. In terms of the patients that shouldn't do it, obviously, if you're pregnant, nursing, those type of things, we want you to stay away from that. And then pacemakers, those type of things. Again, there's a number of contraindications and a whole list on the consent form that I'm sure you go over with patients, or at least there's, like a checklist of concerns that you can review with them. But for the most part, this is the demographic for Votiva is wide open. It is large, and you can treat a lot of different patients who go through and suffer from the symptoms that we talked about, which is great. It just makes it a really versatile device. It doesn't alienate, a specific patient. It's blind light. That's what radio frequency is. And all it does is really help stimulate the muscles and collagen within the vagina and, hopefully get women back to, feeling like their natural youthful self.
Right. Yeah, that's exactly it. Is pregnancy, breastfeeding, and then I love that you mentioned the pacemaker. And then I'll have to add just any active infection. But who if you were having an active herpes infection, you certainly wouldn't want somebody to be doing a procedure there. So that's pretty obvious. So. Anyway, I have more information about this on my website. If you go to dramybrenner.com and under sexual wellness for women, there's a whole page about Votiva with some more information. Thanks for joining us, Jack.
Thanks for having me. I really appreciate it. Thanks so much.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.